Okay, hi guys. We're just gonna talk about why are you advised not to eat anything before going for an OT or before going for an operation. So the reason here is actually because whenever we are giving you a general anesthesia, we are actually paralyzing you. We will give medication for your pain. We'll give medication for your sedation because you're having anxiety. And the third thing we're going to give, because we're going to intubate you, right? You're not going to breathe yourself. So we'll put a tube inside your throat, which is very uncomfortable. And for that, we will use some medication in order to paralyze that. Okay. So whenever you're paralyzing it, all the muscles in your body is going to relax. So in your food, in your stomach, you are having your food, right? And that food might also reflex back through the esophagus, but it does not happen in general condition because we are having a sphincter, right? So that sphincter actually also gets relaxed. So when the sphincter gets relaxed, the food will regurgitate up. The problem arises when the food goes back again inside. So it can go either in the stomach or either in the lungs. So if you're going in the lungs, nasty amount of problems can occur. You will be having pneumonia. That is called as aspiration pneumonia, which is very detrimental case, and you don't want that thing to happen. This is very common in patients who are bedridden, old age, and your mouth is one of the most dirtiest structure in your body. So the bacteria inside your mouth, the microorganism is going to cause a nasty amount of infection in your lungs, which is going to cause you pneumonia. Once you have pneumonia, you'll be going in respiratory arrest. You'll be going in having decrease respiratory output. The lungs will collapse, and then you'll be having increased breathing cycles. The respiration will go up. Once again, respiration goes up, again you will be having CO2 washer, and the chain of even keeps on going. So it becomes a sequence of changes that is very nasty. So old age, we don't want you to have pneumonia in the first place. So that's why you need to take the vaccination very seriously once you hit around 50-60 years. Very necessary. And it is very common in patients who are having prolonged bed rest, who are paralyzed, who are having in coma state, or patients who are having an intubation in the cases, right? So that's the reason. Do not eat anything before a surgery. It's very necessary that you don't eat before a surgery. Any solid food, you have to stop it by minimum of 8 hours of gap. You should not eat anything 8 hours prior to the surgery. And liquid food, only the liquid can be taken up to 2 hours, but preferably I'll suggest liquid, and your solid food should be stopped by 8 hours prior to surgery. This is very well taken care by your primary nurse and your anesthesia team, because you need to follow the advice very strictly. You do not even want to take a single bite of stuff, not even a small candy also. This is going to be very much dangerous once this thing occurs. Okay, so please follow instruction of your anesthesia team and the nurses, and follow the advice of the doctor. Don't try to be hide anything, or don't try to medicate or anything by yourself unless you're a trained medical professional. So this is for your own safety. We also want you to be safe, because once you are in a GA, that is general anesthesia, everything is in our control. But if something goes wrong, we can manage you. But once you start to aspirate, once you start to vomit, and the vomit actually can go inside your lungs, it's very nasty thing can occur, right? So please don't hide anything. If you have accidentally eaten something, we need to cancel your case, because your life is more precious than doing the OT. Obviously, we always see the benefit to risk ratio, and let your anesthesia team, your surgery team, your OT team, the nurses decide for you and not yourself. Thank you. Bye bye.